What up, fam? It's me, your boy, back from the dead. I'm still feeling pretty sick, but today is the first day that I'm actually feeling human, like I can actually do something today. So I have a couple of videos backed up, which is just frustrating because I just came out of this really long depression that completely stunted my productivity on YouTube, which I hate. But I wanted to talk about my tattoo removal because I just got a session done like right before I got sick. It was like 2 days before I really got sick. So I just wanted to show you guys an update on how that's going. It's actually lifting really, really well. Dr. Kwon originally estimated that it was going to take almost a full year to completely remove the tattoo on my arm. However, things are going so well that like I may only need one more session just because it was already so light and it's lifting really well. Like my body's doing its job with eating up that ink. So this is where we're at. This is about a week after the second session. Now you can't really see the full results of each session until maybe a month or 2 months later, and that's basically because when you go in to get something lasered, the lasers are basically there to break up the ink inside your skin, and then afterward it's just up to your body to kind of flush out the ink. It basically goes in there and just eats away, metabolizes the ink that's in your skin, right? So you're not going to be able to see exactly what you're dealing with until like a month or 2 months later. But already after the second session it looks pretty light. Now it does look a little mucky and sort of like muddy. I've noticed just after the laser initially hits the ink, because there's metals in the ink, I find that it looks a little like brown and muddy at first until your body like grabs it and flushes it out, which is fine. I'm feeling really good about it. So I'm actually kind of hopeful that I won't need any more sessions. If anything, maybe one more. The tattoo is so light already that I feel like we have a good picture plane that's pretty flat. It's pretty light enough to go in. Plus the tattoo that I'm going to get is pretty dark. There's a lot of dark colors in there, so obviously it's not up to me. I do need to see Nico in person and let him check it out and see if this is what he's comfortable with. Alright, so we're gonna go into the footage of the actual procedure. However, I do want to give a forewarning. If you guys are sensitive to needles, you might want to skip this video or like skip until the end because there is a lot of needle action in there because I did get lidocaine injections. And someone brought this up in the last video. I don't know if this is a thing, but if you are epileptic or if you are sensitive to flashing lights, you might want to skip this video, basically because the light of the laser is something that flashes and it's kind of inconsistent. So I don't know if that's going to be something that's going to harm or trigger people who are epileptic, but I figured I might as well just put it out there just in case. So yeah, needles and flashing lights, if you guys are uncomfortable with either of those, then I would suggest skipping this video and I'll see you guys tomorrow. So yeah, let's get into it. Let's go. So you can see here I'm using a white pencil to mark around my tattoo. This is basically for me to show the surgeon exactly where I want to be lasered, just so there's clarity.
Okay.
Right now they're putting the numbing cream on me. Usually they put this on maybe 40 to 20 minutes before the laser session. There's Dr. Kwon, my boy. Before we start out, he just likes to sit down with me and review the last session, just see how I healed, if I had any questions, if there were any complications. I like Dr. Kwon a lot. We get along really well, we joke around with each other, and I just feel like he gets me. I'm really comfortable with him, which just makes the entire process just a lot more enjoyable. I think it's great that he's the doctor that's really down to earth, that's really relatable, and just overall charismatic. I think he's a great guy, and I really enjoy working with him. Actually, during the entire process, we were talking about video games, and he's a Final Fantasy VII fan too, so, you know, we got along great.
She wants to have a face in that and the raw face in that. How long did that take? 2 weeks, right?
So here Dr. Kwon is taking off the numbing cream. I'll be honest with you, I don't really feel like the numbing cream does much of a difference for me when it comes to either preventing the sting of the tattoo laser or the lidocaine needles. It's just, I feel like it's just there as just a handy help me. But honestly, I guess I wouldn't know the difference because we've never done the needles without the numbing cream, so I don't know. I think it's a nice courtesy, if anything.
But you just need to lighten it up and cover it, right?
Yeah.
So you probably don't need to go much longer.
Cool. That's great news.
She wants you to do the bottom part. You missed the bottom part.
Which part?
So this tiny little thing right here,
That line?
yeah, this like thing, it's supposed to be
this
like a
whole
little
thing.
packet. So this like,
Oh,
see,
so
it's like
just
one of
keep
these
up
little
to the
packets.
candy.
yeah.
Okay. Right. Wait, how old are you?
It's a very bold question. I'm 28.
But how did you play Final Fantasy VII? That was like when I was
I was a little late to the game. My older sister had bought Final Fantasy VIII, and she didn't understand it, didn't know how to play it, so she's like, oh, Kelly, here. So I started playing it. And then I finished that one, and then I bought 7, because I loved 8 so much. And I remember I bought it all with quarters, dimes, and pennies.
Nice.
It was $14.99.
$14.99. Worth it. Oh, you got it like used at GameStop or something.
Probably. All right, guys, here's Kelly's personal purgatory. I'm just kidding. It's definitely not a fun time, but I honestly wouldn't want to do the lasering without the lidocaine needles. And to be honest, I'm really shocked that there are doctors out there who don't numb their patients before they do the oh my god. I'm looking at this right now and it's so brutal because the whole time, like, I can't see him sticking in the needles, so I'm looking at it now and I'm like, holy shit, that's so fucking brutal. Oh my god. Ah, you can see the needle like in my skin. Oh my god, I'm never doing this again. I'm totally kidding, you guys. Honestly, the needles are not that bad. They are definitely not a fun time and they definitely suck, but like, it's really more annoying than anything else. And after the first initial shots, maybe after 10 shots, you start to numb up anyway, so you can't feel too many of them going into your skin. Again, it's more annoying than anything. It's not overwhelmingly painful. Like, anybody can do it. It's not a big deal. And I'm glad we did, because there were some areas of my arm where I wasn't numb that I actually could feel the laser, and I could actually feel the pain of the laser, and it was awful. It was just terrible. So it's really just shocking to me that there are some doctors that don't numb their patients. I just think that this is an absolute must if you're going to laser somebody, because that pain is just so overwhelming. And if you're getting a big area like I am, I just don't see how the patient is going to sit through 20 to 30 minutes up to an hour of that brutal pain. And just for clarity's sake, this is diluted lidocaine. You can't put straight up lidocaine and inject it into somebody because it will make their heart stop and they will die. Nobody wants lidocaine poisoning, my boys!
Are you feeling these areas?
No. I mean, yes. I don't know. Kind of. I feel you touching me.
But it's not sharp?
No, I don't feel anything now.
How about here?
Yeah.
Sharp?
Yeah.
How about here?
No.
But here it's sharp.
Right where her face is.
So does your mother still collect royalties for East Bake Oven?
Oh no, it didn't work like that back then.
Oh, didn't get royalties. Our tag.
Oh.
Are you ready?
Yeah.
And what doesn't she say? I think so. You know, we have those telfa pads now that we can use.
Okay, so we're starting off with the first laser. We use a total of 2 lasers. One is meant to lighten up all the black areas, all the areas that are super dark, and the other one is geared toward more brighter colors like yellows and reds and things like that. This is the laser that we spend the most time on. He goes over everything pretty thoroughly. Right now, I can't feel anything, so this is really just a walk in the park. However, I did mention before there were some areas that for some reason the lidocaine, yeah, see my lip right there? For some reason, the lidocaine didn't really work on the inner corner of my arm up to my armpit. I don't know why. Maybe it's just more of a fatty area and the lidocaine was just too dispersed. I don't really know. If I were to describe the pain that I felt from the laser, even from just like the subtle shocks that I felt on the outer corner of my arm, I would say it felt like electric bee stings, almost kind of like a snapping of a rubber band, but very like hot and sharp, very, very sharp, like it stings. The other thing that I wanted to mention is you definitely get the scent of your skin burning because that's really what's happening. The laser is causing superficial burns on your arm. And that can be kind of scary once your brain registers like I can smell my skin burning. It's definitely not a fun time.
Do tattoo artists get offended when you remove their tattoos?
Nah.
Artistically, it's not.
Yeah. Time really flies once we're doing the laser. Honestly, I don't think it's more than maybe 10 or 20 minutes that I'm in the chair during the first laser. Maybe even less than that. I always feel like I'm only there for 20 minutes. It just goes by so quickly. This right here is the second laser. This is the one for all the dark colors. And you can kind of see the camera is actually having a hard time picking up the aperture of the light. It almost kind of like flashes, like see that? It's just, I guess it's something about the laser, it's so bright, and in person it doesn't show up as green. That's just kind of the way the camera is picking it up. Obviously, I'm not able to look at any of this. I have the little caps over my eyes, and you can't look directly at the laser without the goggles on. At the end, Dr. Kwon wraps my arm and puts a little Vaseline on there. This time he wrapped it pretty tightly to compress it and prevent it from swelling. The last time I was in there, it swelled up so bad that my arm was just huge for a couple days. And the compression actually did work, so I didn't have to deal with a bunch of swelling. Thanks for watching this video. If you guys have any sort of questions about tattoo removal, go ahead and post them down below. I'll try to answer them to the best of my ability. I noticed in the last video there were a lot of questions, and those questions kind of ranged from people who have no knowledge in the tattoo world and some people who are very knowledgeable and actually looking for information. So again, I'll try to answer them to the best of my ability, depending on what the questions are, is depending on how much time I have to answer those questions. So thanks for tuning in. I will see you guys tomorrow. Bye-bye!